Hi everyone, my name is Ashley Harding. I'm the Community Development Specialist here at the National Indian Child Welfare Association. I'm also working on the Western and Pacific Implementation Center project in Alaska. And so today the webinar that I will be providing to you is discussing the tribal in-home the tribal in-home services system of care model that we have been working on in the state of Alaska. And again, this is in partnership with the National Center for Substance Abuse and Child Welfare in NICWA. And this is just a map just showing you the NCSACW in-depth technical assistance. And as you can see, Alaska is one of the areas where this technical assistance was. This slide is just indicating, as I had stated, the WIPIC project in Alaska. Our 16 tribal partners that we have been working with across the state of Alaska. Portions that are highlighted indicate the tribes who are receiving funding to implement the in-home services model. And we are still currently working with those same 5 tribes. And so they're, throughout the region, Association of Village Council Presidents is in the Bethel area. ONC is also located in the Bethel area. The Central Council, Tlingit Haida in Juneau, Manilik in Kotzebue, and Nome Eskimo, or Queric, in Nome. So again, like I said, today I'm going to be discussing the issues of substance abuse within Native communities and how to best work with those communities. And the specific examples that I will be discussing are centered around the communities that we've been working with in Alaska. And just, again, how this, the aspect of parental substance use disorders factor into the majority of our child welfare cases that we're dealing with. So just an overview of our workshop, really understanding the nature of the problem. In child abuse and neglect cases, the increase for risk for American Indian and Alaska Native children, how you provide a holistic approach in working with families who are substance using, coordinating the substance abuse interventions with child welfare services, and how, as we move forward, how to implement that into your in-home services model, and especially the model that we're working with in Alaska. So just a quick overview of the challenge around substance abuse and working with American Indian and Alaska Native families is that many of our children are affected than we give attention to, and this happens across the nation. The cost to treat children is far greater than the actual prevention measures that are taken, or even the fact of early identification of issues that are happening within the family. And again, the fragmented efforts and focus more on immediate fixes, kind of the Band-Aid, putting a Band-Aid on the situation rather than looking at how we can make systems changes. For example, how we can change an organization or an institution's attitude, changing those behaviors, but also looking at how we change those relationships in the places that we're working with to provide these holistic services to families. On this slide, this just talks about the national challenge that exists around substance abuse and working with substance abusing families. There's about 8.3 million children who are living with one or more parents who is dependent on alcohol or needs treatment for illegal drug abuse. And so in those prenatal screening studies, about 11 to 15% of the newborns are prenatally exposed to alcohol, tobacco, or other illegal drugs. According to the CWLA, the Alaska Children's 2010 data, there are approximately over 180,000 children that are under the age of 18 who are living with one or more parent who is dependent on alcohol or needs treatment for illegal drug abuse. And in 2007, an estimated 5,000 children ages 12 to 17 and 29,000 adults aged 26 and older were dependent on or abusing illicit drugs or alcohol. And so the other, go ahead and move forward, sorry. The other statistic that, that is that we're facing in the work that we're doing in Alaska centers around the number of births in Alaska that relate to fetal alcohol spectrum disorder. You know, over a 6-year period, one of the statistics that I'm going to talk about in this slide is that over a 6-year period, you know, Alaska experienced a 32% decrease in fetal alcohol syndrome. And the other question that's coming out is, you know, where this decline is coming from, but also just in general, if there's this decline, you know, what is the, you know, why is there a higher rate of prevalence among non-native children, and why that decline is associated to just Alaska Native children specifically. But also looking at, you know, across the nation, why Alaska has the highest rate of the fetal alcohol spectrum disorder. And so when we're talking about kind of some of this preliminary information that I just shared with you, is just kind of giving you the basic synopsis of the issues that are going on within substance abuse and child welfare. And, you know, looking at, you know, what is, you know, really what is the connection between substance abuse, child abuse and neglect, and that connection into our tribal communities. And again, as I stated, more connected with the WIPIC project and what we're doing in Alaska is how are we working with the Alaska Native communities to help address these issues. So again, the question, you know, which is what is the correlation between the parental substance use and child abuse and neglect? And as I'm talking about these issues, just thinking about for your specific community, you know, what is the percentage of the cases in the child welfare system, you know, that parental substance use is a factor in removal. You know, in our work that we're doing in Alaska, you know, we ask these questions as we're out in the communities and providing technical assistance, and this question is proposed to them. You know, the majority of the hands go up because in relation to a lot of the issues that we're hearing is that there is removal when it comes to a situation where a family is substance misusing in the tribal communities or in the villages. And so it's, you know, what does this impact, or, you know, what does this situation do to a child? And so what I'm going to talk about next is just the general impact that this has on children, but also the impact that it has on parents and in our tribal communities. I think the first thing that when you look at the impact on children and families of the issues around substance abuse, it really, you know, interferes with, you know, a parent's ability to effectively parent. The whole aspect of an individual's judgment. They're unable to fully comprehend the situation at hand or what they're doing, but also the ability to protect their children. You know, as again, everything is based around this aspect of judgment and, you know, the things that they are able to comprehend at that point in time. In addition, it also really affects the way that you nurture and that you foster a healthy child. The children are not in a safe environment, and they're not, you know, being given the chances that they would in another family. And so the next slide, please. Oh, sorry, that slide, just leave it there. So some of the statistics that go in hand with this are if a child is in a home where there is substance misuse, alcohol abuse, they're 2.7 times more likely to be abused. Again, they're 4.2 times more likely to be neglected than children of non-substance abusing homes. But one of the aspects of this that's really interesting is that there's an increase of repeated child abuse and neglect if these situations are not if the families are not assisted or if the children are not heard, that there is this continuation of abuse or neglect. Again, as you're thinking of the families that you're working with in your community and how substance abuse could potentially affect that child and that family, looking at some of the, some of the symptoms or even some of the basic, necessities that they need. For one aspect is there's this, just severe and inconsistent, inappropriate discipline. Going back to judgment, there kind of a aspect of the parent or the caregiver not really fully understanding what they are doing to that child as far as abuse. Basic needs are, a child needs food, shelter, clothing, medical care, education, and supervision. And if they're under that substance, the child is not receiving the basic necessities that they need to be healthy and to have healthy outcomes in their life. There's also the general disruption between the relationship of the child and the caregiver, the child and the parent. That relationship and that trust is going to be dismantled, or it's not going to be as well developed as it should be if there wasn't substance abuse in that situation. Again, there's this aspect of safety. If a parent is using meth, or they might have a meth lab, what are the health hazards and health implications for that child in that home? If there are open bottles of alcohol laying around, what are the implications that's going to have on that child or that baby who might be crawling around in the house, and how some of those situations can be alleviated by a tribal child welfare worker. But also, in more severe cases, when it comes to substance abuse and child welfare, is really looking at how that substance can traumatize a child through the physical, emotional, and sexual abuse and exploitation that could potentially occur in that situation. And if these situations are not addressed and not alleviated in some form, looking at the trauma that as a result of that child being removed from that home. As we've experienced in Alaska, a lot of our children, in the Alaska Native children in that region, are being removed and placed in non-Native homes, which is of great concern that is occurring. And one of the aspects of our NICWA Heritage and Helping module that is a really great depiction of, as a tribal child welfare worker, an OCS worker, CPS worker, is this statement of, when the parent's need for a substance outweighs the needs of the child, is, that aspect of where there needs to be intervention for that family, how you're going to work with that family, what are you going to do when that child is in this aspect of neglect. And this is potentially where there's going to be where caseworkers or tribal child welfare workers are going to see this chronic child neglect. And talking about the chronic child neglect is really, a serious pattern of deprivation of the child's basic needs, developmental needs, physical needs, and their emotional needs by the parent or a caregiver. And this occurs, again, as I had stated in an earlier slide, of, a parent under substance abuse is taking care of their needs. They're not necessarily taking care of the needs of the others that, like their children in that home. As we think about these aspects, we think about, how do we work with substance abusing families? And I'm going to kind of jump around a little bit. I apologize to our slide advancer, because a lot of what I'm going to be talking about is focused on the tribal in-home services model. The tribal in-home services model, as you see on your screen, it was developed for the state of Alaska to address the disproportionate placement of Alaska Native children in out-of-home placement with non-Native families. And so the graphic that you see on the screen right now is really just looking at the tribal in-home services as a system of care. And that within each community, Alaska Native community, that it's implemented and it's developed in very specific ways that is catered specifically to their community. But there's also a set of 8 core elements that are addressed in the tribal in-home services model that help to provide holistic services to the family. And this includes, working with substance abusing families, how that is provided in that 8 core elements. But keeping in mind this notion of, this important aspect of safety and how the safety of a child is within that model. So as we look at the system of care, the in-home services model, also it's called the Tribal In-Home Services Practice Model. It's looking at, like I stated, these 8 core elements. The aspect of case management, parenting support, healthy relationships, sobriety, domestic violence, cultural strengths, basic needs, and life skills. And as Terry Cross and I have gone out to these communities, these are the 8 core pieces that we discuss in working with families who are substance abusing. Because as we work with families who have these issues, it's really ensuring that it's not one aspect of this circle that is out of balance. It could be several. So for example, you could have a family whose child may have been removed due to substance abuse, say it's alcohol, and that family, there's issues with domestic violence. They don't have basic needs, they don't have clothing, they sometimes have food, life skills, looking at, does this individual have their high school diploma? Do they have a GED? Do they have a degree at all? But also looking at what are the supports that that parent has, looking at extended family, looking at, other support networks that they could potentially have, friends, and so forth. Looking at healthy relationships and seeing how, what has been the pattern in their life of relationships, whether that has been with a significant other or with their family or within the community. What do those relationships look like? The aspect that we're talking about in many of our tribal communities is this aspect of trauma and how trauma impacts our communities. And so this is just one of the tools that we use to help discuss how we provide that holistic approach. And so as you can see in the 8 core elements, there is the sobriety bubble. And so, again, like I was talking about the other components of the 8 core elements, looking at sobriety is looking at what are the services that are available to that family, and how can I, as a tribal child welfare worker, work with all of these other pieces in order to provide my family with the services that they need to ensure that that child is being kept safe, or to ensure that this family is going to get all the things that they need to become healthy. And in one of the upcoming webinars coming up tomorrow, Nadja Jones is going to be talking about the linkages and cross-system collaboration between child welfare, substance abuse, and child welfare, and how all these components can work together to provide better services to families. And so, again, thinking of any cases that you currently have going on in your community around substance abuse, I can give just, again, another general example of a family. Say it's a mom whose children are potentially going to be removed because they suspect that she is substance abusing. One of the great aspects about the system of care in-home services model is that it can be used as a prevention tool. One of the things that I had mentioned kind of further in the beginning of the webinar is that more time is spent on caring for children who are directly impacted by issues going on around substance abuse. So they're impacted by that neglect, they're impacted by that abuse, they're impacted by physically, emotionally, and being sexually abused. And so how can this tool be used to prevent those things from happening? As a tribal child welfare worker, this is where you can utilize this tool. If you get a report from a community member saying, I hear, so-and-so is, drinking and their children are at home, this is where as a community and as a tribal child welfare worker that prevention can take place then. That you can go into the home and you can use this in-home services model as a tool to address those needs early so that the children don't have to be removed and that they don't, depending on the severity of the case, of course, and ensuring safety of this child, but working with that family as a case manager to provide all of those other elements of support that are in the in-home services model. Asking the questions of why is this person drinking, or how can I help address these issues? Where can I help direct her to find her support network? Accessing, the grandmother, that is in that community, or an elder to come in to help discuss these issues with that individual. So this slide, I'm sorry it's not very clear, but this just helps you to, it helps to showcase what it is that we're doing in the communities, and this is one of the less detailed ones that I was able to provide. We have some very detailed pictures of our work out in the community, but I didn't want to overwhelm everybody with a bunch of lines and words that would be all over. So this helps to showcase that when we go out to a community and we give them we ask them for a case that is currently going on, we do a case staffing around the case, and we ask them, we hear the case, what's going on, and we have all of the tribal child welfare workers there, and we go through each of the elements and talk about who's providing that, where can that support be provided. So if you can see in the case management tool, we have Office of Children's Services is providing case management. The Tribal Social Services is providing that case management. And so these are two entities that are working together with this family. So this is a child who is already, this is a child that could potentially be removed or is in that process of, is already in the state's, I guess, radar of potentially being removed from the family. But this case is just in time that the tribal child welfare worker is able to be alerted to the case and to start working on it. And as we move over into the parental support, it's looking at what services can this person, what services does this person need? So for example, if there's sexual abuse being reported or anything like that, it's talking about the sexual assault response team. Does that exist? Does that exist for that child? Having grief counseling for that child or for that parent of potentially what could have happened. Accessing their child's advocacy center. And so, it's going down into healthy relationships. Is there a way that this parent could be connected with the community? Is there a way, is there support that person needs? Is there support that child needs? I think oftentimes in these case staffings or these case plannings, we do forget about our children. And we plan all the services for the parents that need it. And so the other aspect of this is that this can also be used to help address the specific needs of the child. And as you look in the sobriety section, it's looking at the assessment. What tools can be used to help that family? You know, at first there's the assessment that takes place, but what services are readily available in that community that that parent can take advantage of? Again, you know, we talk a lot about in this work that we do about providing a holistic approach, and so a lot of times that includes our cultural strengths. What aspects of our culture can be incorporated into working with this family? We've heard examples of tribal child welfare workers, ICWA workers, taking families with them to go out subsistence fishing, subsistence hunting, you know, bringing them in to learn how to feed. This was a part of their case plan. This was a part of their treatment plan, that they would do these things. And, you know, what we've heard from the communities that have implemented those cultural activities, those subsistence activities, is that there is a decrease in their usage of whatever substance it may have been, so alcohol or drugs. And, you know, they're, you know, just thinking about the culture as a protective factor, the parents and the children, and how you, even with children, how you can connect them with a youth group, a youth you know, group that does traditional dancing or traditional singing. So these are aspects that can help heal that individual while the kind of mainstream aspects of their case are being dealt with. So making sure that they're going to counseling, making sure that they're going to all these other pieces, but still empowering that person with the cultural pieces. So, you know, this again gives, hopefully this gives people kind of a look into how we use this case, how we use the in-home services models, the system of care, to provide that service to those families. So this is an overview of, and SAFERR means Screening and Assessment for Family Engagement, Retention, and Recovery. And it's a really great tool to plan a system of care. It discusses, you know, the collaborative values that can be used to really talk about some of the important disagreements and different perceptions, but also the differences in attitudes about practice and policy. Again, you know, if you can go ahead and move forward, there's a little definition of what SAFERR is, and it's based on the premise that when parents misuse substances and maltreat their children, it's really, you know, working collaboratively with child welfare, you know, and the alcohol and drug programs and the courts to treat that individual holistically. So you know, the principles that exist within this are looking at, you know, when we think about child maltreatment, when we think about, again, as I was just describing, the in-home services model and some of the issues that are going on that are very urgent, that when we think about substance abuse and child welfare and when we think about our communities and the issues that they're facing, that these demands are urgent and they need our attention, but they also need our systems to collaborate together in order to provide better services to that family. So again, so it's not having that fragmented approach that I had discussed earlier. Again, as a staff person in child welfare, tribal child welfare, substance abuse, or court services, there is power to change lives. So thinking about, again, the systems change work, how we're changing attitude, how we're changing behaviors, how we're changing these systems that are working with our families, and what is the power that you as an individual have to help make those changes. And so looking at the in-home services model is really, a tool for our tribal child welfare workers to assert that sovereignty that that as tribes and as tribal child welfare workers, we have the authority and the power to take care of our children, and this is how we're going to do it. And so again, just to reiterate the aspect of the in-home services model, that these are services and these are programs that are offered within those communities. So when we develop the in-home services model for some of the tribal communities that we're working with in Alaska, those in-home services models are reflective of those specific communities. And then even looking at the last little bullet here is that family members are necessary to change, and how you as a tribal child welfare worker, an ICWA worker, a community member have the power to empower your community and empower the individuals within your community. I'm just going to go through these pretty quickly, or pretty, I guess, brief. The SAFERR model is really is a team tool. The family is the focus of concern, just like in our in-home services model. In the middle, there was safety, but also that case plan centers around that family and that child. You know, looking at or thinking about how I described, you know, again, holistically, how you work with that family, looking at all those 8 core elements. You know, when someone is substance abusing, it's just not that one issue that they're facing. There's probably a multitude of other issues that are going on within that family or within their life that have to be discussed and have to be, you know, provided support. Again, assessment is not a one-person responsibility. You know, the aspects are coming from different. It's coming from the professionals. It's coming from the community. So that assessing what is going on just isn't the responsibility of one person. Let's see, the information is limited and there's no research-based answer. You know, it's looking at the field of substance abuse, and especially in working with our tribal communities, it's ever evolving. You know, when we're working with our families and we're working with our children, there's no time to lose. You know, and the faster that we're able to get in the door to work with that family, you know, the more time that we can help sustain those relationships between the parent and that child. And then ICWA creates specific guidelines for working with American Indian populations. Again, you know, as I stated, the tribal in-home services model that has been developed by our tribes and that is, you know, being developed with WIPIC is really centered around ensuring that our tribal child welfare workers in the state of Alaska understand that they have that power and authority to take care of their children. They have the power to advocate for children, you know, that are in their villages or within their region. And just the last point on here is just that developing and sustaining effective collaborations is hard work. The WIPIC project in Alaska has been going on, I believe, for about 3 years now. I just started in February with the project, so it's been going on years prior, but it's also, you know, the work with the state and the tribe has been going on for many years before that. And so, you know, working collaboratively is very hard. It's looking at that, again, the systems change, the systems transformation of, you know, changing all of these different aspects and how you, and the difficulties that come with that, but how you and your tribe or you and a state partner can get through that. I'm not going to go too much into detail about the organization of SAFERR. I believe I pretty much went through that just now, but basically I'm going to go through the next slide. And again, as I had stated in the webinar tomorrow by Nadja Jones, she's going to go more into detail about cross-system collaboration. And so basically, the organization of the SAFERR model is building cross-system collaboration, your collaboration within and across systems, but also collaboration in action and working together on the front line. So the next aspect that's going to be talked about, and I'm sorry, this is a little bit out of order, is talking about assessment and how assessment is a process, and that it happens along a continuum that determines the presence and immediacy. Excuse me. Is there an issue present? What is the immediacy of the issue? The nature and extent of the issue? You know, and asking what is the nature of the issue and what is the extent of this issue. So again, as you're looking at the in-home services model and you're working with a family and you're starting to case plan with that individual, asking these questions even for internally for yourself, but also asking that in a way that fits with that model. And the last point on this is just developing and monitoring change, transitions, outcomes of treatment and case plans. You know, what is the response to the issue? Even how is someone responding to this issue? You know, are there changes that have been demonstrated? Is this family ready for this transition, and did the interventions work? Are definitely questions that as a worker you'll be asking yourself. The next couple of slides are really just going more into the definitions in terms of the processes behind what goes on within each of what's going on in the alcohol and drug services, the child welfare services, or the court services. So what's happening at what point in time? The question of, is there an issue? And if yes, there is an issue around substance abuse, and there's children in the home, then that's when that child abuse report is taken. And this is where, as tribal child welfare workers, this is the point where you could either be getting involved prior to that screening or getting involved right when that report is being made, so that you are involved in that case throughout its lifetime or throughout its entirety. And so, like I said, I'm not going to go too much into this, but again, as a tribal child welfare worker, thinking to yourself about, where could I have been in this process to help prevent this if that child was removed? How can our tribe work with this family to ensure that that child stays here? And this is working really well in a lot of the Alaska Native villages. We have an example of several villages in Alaska where there are no children in state custody. And so these are villages who, again, are asserting their sovereignty, and they have a well-functioning child protection team to take care of their children and to address the needs that are going on. So, if you're in the state of Alaska, definitely getting a hold of those villages to see what is working well for them. What are they doing, that they don't have to have that state coming in to, work with their families and children. So in this one, the example I'll give is, what is the response? There's a treatment plan that the alcohol and drug services are utilizing. This is when the case plan comes into effect. So if OCS or CPS is already involved, what does the tribal case plan look like that can match with those? And it's really trying to align these services so that the families are getting the services that they need in a timely fashion, and preventing the children from being in placement longer or being in foster care longer, or being away from their community longer. So how do we align these different aspects to ensure that our children are brought home and getting, the things that they need from their family. And so the next couple slides, again, I'm just going to give you just a general idea that these are, this is a Pathways of Communication template. It's really, the identification through community or family awareness of signs or symptoms. So basically the process that happens when, a case is reported and how you can go about working with that family. There's several different slides that cover this aspect. I'm not going to go through those. So this just gives you a visual of the SAFERR model development and how it builds, again, how it builds cross-system collaboration, establishes individual and cross-system roles and responsibilities, identifies frontline collaborative practice, and it all, is to establish and monitor individual and cross-system outcomes. So again, thinking about the in-home services model, it's basically, when you think about the in-home services model and you're working with a family, coordinating all of those different services and those collaborations that happen to provide those individual, provide the families that you're working with the specific resources that they need. So the last few slides are really, it's just talking about technical assistance resources through the National Center for Substance Abuse and Child Welfare. That basically, as you're reading this, there's options for tutorials, there's resources on there, there's toolkits that can be helpful to your community. And these are definitely things that we have brought out to our Alaska villages to provide them with these resources. But this just gives you an idea of what's available through the National Center for Substance Abuse and Child Welfare. And there's a couple slides after this that talk about online training. And what's really a unique aspect is NCWA is involved in that online training to ensure that the individuals taking the different trainings are very knowledgeable about ICWA and knowledgeable about working with tribal families. And so I'm not going to go through all the resources, but if you just, if you could go to the slide with the website, this is where all of the materials can be accessed to benefit your community. And that is, I'm done with my presentation. So if there's any questions, please feel free to ask me.
Thanks, Ashley. That was a great presentation. This is Han Dao from the National Center on Substance Abuse and Child Welfare.
Oh, great. We actually have one question that just came in.
Oh, okay. So the question is in regard to whether the presentation is available on the website. Yes, as of today, it is posted for you to download. We'll also be, well, we have been recording this webinar, and we'll be posting the webinar recording within the next 3 weeks for you to access at a later date.
This is Ashley. If there are materials that from the webinar, for example, like I was talking about the tribal in-home services model, if that would be a benefit to you, please email me at NCWA, and I can get those materials to you, and I can go through it further with you to help clarify anything. I don't believe my email is on the PowerPoint, but please feel free to email me at akay@ncwa.org.
The presentation and the recording will be available on this website, www.cffutures.org/webinars. So that concludes our webinar. Ashley, thank you so much. And do you have any other concluding comments?
No, I just really want to thank everybody for attending today and taking the time to listen to me. I really appreciate it.